Thanks for joining us. This is The Economy. With me in my office right now is none other than the Yang Berhormat Anfaal Saari. She is the Exco of Women's Development, or the Executive Councillor of the Committee of the Women's Development here at the Selangor State Government. We're going to be talking about the Selangor International Care Summit. It's going to be done on the 9th until the 11th of October this year at the Kuala Lumpur Convention Centre. YB, thank you very much for taking the time to speak with us. This is, of course, the International Care Summit is on the back of the Selangor International Business Summit, SIBS, which AWANI has been covering for quite some time now. How does the Care Summit tie in or jive in with the SIBS 2025?
Okay, thank you, Ibrahim. I believe that care economy policy of Selangor, when we launched it in November 2024, we have 39 strategies, and we believe that by organizing this summit, it will be an umbrella where we can actually gather all the stakeholders and covering from the expo, the exhibition, and talking about through forums, and this in the frame of economy. So it jive with Selangor International Business Summit. So previously, for the past 8 years, Selangor International Business Summit has been covering, I think, 5 to 6 components, where from the aero parks and also for developers. And this year, they dropped one program or component, which is health science. So I requested for another element, which is care economy, to be included in Selangor International Business Summit.
And of course, what will be some of the key objectives that you intend to achieve over the 3-day period of the summit?
Okay, so there are many stakeholders, namely the caregivers from either individuals, family members, or also the CSO, civil society organizations. And we also have policymakers, the academias, and from this 3-day program, we'll have throughout the 3 days Care Expo, where we gather 60 exhibitors from the healthcare line, from the think tank groups, and also we managed to get 3 JLC from states of Selangor, like Wanita Berdaya Selangor and Selgate, and also Yayasan Warisan Anak Selangor. And other than Expo, we'd like to showcase what is it exactly Selangor Care Economy Policy that actually can benefit either the industry players and also the caregivers. And second objective, we would like to have engagement session with the NGOs and also the caregivers, where currently at the moment we don't have any legislation that actually protect the interests or legislate for the caregivers. We yet to have RUU Profession Pekerja Sosial, but then that social work doesn't really focus on caregiving, but then we would like to hear what are the issues, the real issues from the caregivers. So the third one is to promote or position Selangor as the hub for care economy in the Asian region, so that we can actually promote this industry, the care industry, for the players, and also attract in either care financing or investment in Selangor.
So let's unpack all 3, I suppose. The first one is, of course, the care economy policy of Selangor. Maybe we can deep dive into that for a bit, because even I am unfamiliar with the care economy policy of Selangor. What is it that you'd like to highlight ahead of this summit for our viewers right now that's watching this?
Okay. In reality, we have to accept in 2030, we are going to hit of aging nation, where 25% or 15% of our population will be 65 years old and above. So there will be a slowing of economic activities, and we also have issues of low fertility rate, which is a replacement rate is 2.1. But currently Selangor is among 4 states in Malaysia where we have only 1.6 replacement rate or total fertility rate. So looking at this spectrum, the elderly and also childcare, so we have to consider the beneficiaries of care, namely childcare, the elderly, the sick, and also for OQ or person with disabilities. So in Selangor Care Economy Policy, we have 5 pillars. First is on the advocacy and promotion, second one on the legislation and guidelines, and good governance, and third one is to upgrade the pathway or the career path of caregivers, and fourth one is collaboration and investment, and fifth one we would like to promote the innovation and technology within this care economy.
All this is actually quite crucial, and while I'm familiar with the replacement rate of Selangor being 1.6, there is also another element that we need to look into: emigration into the state as well, which is the highest among other states, more so than wilayah actually. Wouldn't this bring about that whole idea of overpopulation, or in terms of demographic changes, it does bring some sort of stress towards how we manage our elderly here in Selangor?
Towards immigration, we want to position that with the active population, which increasing the productivity.
Yeah.
So we want to change rather than focusing on only E&E, electrical and electronic manufacturing. There's another segment that can contribute to our GDP or Selangor economic activities, which is servicing. So other than hospitality, we see the high populated area like in Petaling Jaya, where most residential houses change or transform into like senior living. We have assisted living, independent living, but we see that there need a change or accommodation of hybrid model. That's what we call it care diamond, where we redistribute the responsibilities between only government, through public institutions, to private, and reshare between a family institution, the private sphere, to community base. So there are multiple models that one size doesn't fit all, where actually, more workers, but we would like to create career pathway for the caregivers and care workers.
I'd like to also look into the second element that you spoke of just now, the first being the policy, the second being the care economy worker protection. We have the Rang Undang Gig Worker, Rang Undang Dasar Gaji Progresif, pardon me, not the bill. How does those kind of national level policies assist in the vision of Selangor, especially when it comes to your portfolio, women empowerment as well as the care economy, trying to tie these up from state lawmaking ideas or mission with that of the federal?
Okay. For instance, we rolled out, or we organized this program called Care Accelerator Program, where it is our test case or experiment on how do we actually promote and encourage these care players. For example, we have one of the winners is Teman Malaysia. So Teman is a companionship. What they did is it's like a gig where they can use apps and technology or whatnot, where they provide within a certain radius area that the client might call them to get their services, whether to being a companion for the elderly to go to the hospital or for their running their errands. So this will tie with a gig economy gig undang-undang, and also that there's some loophole in terms of protecting the rights of caregivers. So what we like to push for federal to come up with a undang-undang akta that actually protect in terms of career projection and also the rights for the care workers. And another one is how we can actually protect these workers rather than going to abroad. For example, we have a pool of nurses from MSU University or other local universities, but they are going to other countries that are offering them higher salary. So this is why we put the first pillar is advocacy and promotion, where we want to destigmatization of care workers as like welfare or charity work. So by putting the importance and getting more investment, it is very important and critical to ensure that all these federal act and legislation will actually promote these care economy activities.
Through my work at Yayasan Penraju, we also did assisted care living program for our talents to learn how to become advanced caregivers for the elderly. But I am saddened to report that many of our talents that we trained under the government funding that we receive from Yayasan Praju, many of those talents have left for Australia specifically because of the higher pay wages there. It is with the intense anticipation that one day they would return, but we don't have a program here in Malaysia where assisted care living, I hesitate to call them nurses, but more of assisted caregivers or care living givers. We don't have that advanced stage yet where we can also reduce the burden on the national healthcare system, reduce the need for us to have doctors and nurses as well. Do you see this talent shortage, especially in this area, a widening concern and something that we need to quickly address in order for us to continue to support the entire ecosystem of the care economy?
Okay. I foresee the potentials because we had early discussion with Bapenas. It's like an EPU for Indonesian government, for Republic Indonesia, where they want to have like internship program with Malaysia in terms of caregiving rather than like domestic worker. So that talent pool of their workers to be trained in Malaysia and come back to their country, that's another potential. And second one, how could we do certification? Like currently under Kementerian Wanita, they have this program under Institute Social Malaysia to train the workers, the care workers. But we yet to see how that can actually guarantee the career projection for the care workers. So what we want to do in Selangor is to do the certification, possibly through UNICEL, our Selangor University, how we can actually advocate and change not only for the nursing diploma but also for this care worker, because we like to identify this TVET. Actually, there are vast opportunities for our youth out there who didn't want to pursue for other higher learning education institutions. So I believe we have to create this pathway, and in fact yesterday we had discussion and getting inputs from the NGO, namely like Mesok Care. So Mesok Care based in, if I'm not mistaken, in Negeri Sembilan, and they already tied up with Perak state government to get funds. For example, they have this like fund of a grant of 5 million ringgit to give trainings to the local people and giving care workers. And what I see it is interesting is the offerings is quite high, so that they can retain their talent. They started with the offering of 2007 to 3007. So it has to be interesting enough, and I mean to entice the talent pool to stay in Malaysia. So this is how we can actually do it, by government intervention, collaboration with the private sectors, and also getting support from the community like the civil society organizations.
Speaking of which, we also need to look at the market sizing of the care economy and of course the cultural dimensions of it. I would assume Chinese communities would have little to no friction when it comes to care economy, caregivers, but I'm not too sure about other communities and other races. Do you see this as an impeding factor on us growing the care economy even further? Or how do you see this evolve into a situation where once we become an aged nation in 2030 or 2050, will sentiments then change when we approach those kind of time frame?
I strongly believe that even in among the Malay and Indian community, let's focus on Malay, where we have this spiritual belief of birrul walidain, like serving your parents, doing ihsan, like it's like repaying their deeds. We want to have a hybrid model where it's like a daycare for the elderly to address the issue of loneliness and also depression. Because when we talk about care, it's not about health care, it's about the quality life after pension age. So when we have findings or data from the researchers, some of these institutions or daycare for the elderly, not only addressing the issue of children who are busy with their work life and whatnot, but then more on engaging with their peers or colleagues. So we like to shift or change the paradigm of sending your elderly is like dumping your parents, like dah tak nak layan parents or whatnot. But then it's more on having a quality life for both the children who still have to earn income by working, and also for the parents to have like proper engagement with their colleagues, their peers, and they can actually have quality life by having like pondok modern. And I'm proud to say that in Selangor we have Salgate as our JLC, who have senior living senior berhad. Is a project of developing Malay Muslim independent and also assisted living in Bangi. So this is kind of models that we want to shift and to prepare our state to boost the economy. We don't want to come 2030 when there are plenty of elderly and we are not prepared in terms of the infrastructure, the model and the system to provide the support for the elderly, and yet we see the impact, the deteriorating impact to the economic activities.
So this is the part where I have to touch a bit about politics, because for the first time the Pakatan Harapan Prime Minister is in sync with the Pakatan Harapan Menteri Besar of Selangor. With this relationship, do you see upsides in the past few years of this administration, the Mandani administration, when it comes to state-federal relationship? I think the whole country knows that Selangor is the richest state in the land. We also know that immigration intrastate is the highest. Traffic between the state and federal is the highest. Everything is the highest. It's like just logical. But in terms of legislation, framework, governance, gazettement of rule of law and many others, has that improved between state and federal, specifically between Selangor and the federal territories?
I would say Selangor is more progressive and it is easier because less bureaucracy, because when you sit in the federal, all the Kementerian has to consider all kinds of legislations like rule of law, but for instance, for the person with disabilities, in Selangor we just launched Yayasan Insan Istimewa Anak Selangor, where previously it was only a department in Yayasan Warisan Anak Selangor, and under the purview of the previous Exco by Dr. Siti Mariah, she pushed this agenda of launching it as a Yayasan foundation, where we can actually leverage on the private and corporate contribution. So Tengku Permaisuri Selangor just launched it on the 9th of August. So this agenda on upgrading the quality of life for a person with disabilities, I mean, we have not stumbling block, but then it's like it's an obstacle to get through in terms of legislation and protection for the person with disabilities. We cannot do enactment yet because there is an act for the person with disabilities held by the federal. But
so if you do an enactment, it would contradict the act.
But there are other matters that actually we can discuss smoothly with the federal government, such as for women policy. But then I could see that with Penang as an example for the discussing the agenda of the women only additional seats to us. It didn't get through in Penang, but then we promote it and discuss that agenda to Kementerian Wanita. And last month we organised, Wanita Berdaya Selangor organised Gender Outlook Forum. We managed to invite our Menteri, Datuk Sri Nancy Shukri, and she fully supported it. So with this kind of alignment of Prime Minister from Pakatan Harapan and also Menteri Besar from Pakatan Harapan, we really hope that most of the agenda politically can be done smoothly with this. And
we've seen how Selangor has performed while the Prime Ministership is not in sync, and so in case or in the event of a situation where it's a reversal, it would be business as usual for Selangor, but now there would be an upside. Do you see some opportunities that have yet to materialize, considering that the political alignment is there, and perhaps you need a little bit more time in terms of trying to get more out of this relationship and alignment between federal and state?
Okay. For instance, for care economy, when Menteri Besar handed me this responsibility, it is like tebas lalang. There was no reference at federal at all. So we managed to start with a symposium, a technical working group, and within a year we managed to roll out or launch this care economy policy. We had discussion with Kementerian Wanita. There's some dispute in terms of the terminology, whether they want to use care economy or care industry, and the latest one is long-term care, LTC. So this discussion is actually for me healthy, because we also invited to international conference discussing about care economy.
So what did you guys land on? Care economy, not long-term care?
For Malaysia, for Selangor, we are very clear about it, because we use this care economy, how care being used as a catalyst or enabler for this activation of economic sector, particularly in service sector. And by looking at UN Women model, they frame it as one of the tiers in economic sector that actually become a prime enabler. Once you remove it, or you don't focus it, or it is hidden or invisible, it will cause other economic sectors to collapse.
There's also some interesting elements here, because by being state government, many of the municipalities are within your ambit, and rezoning of some municipalities to allow for residential housing to be changed into care centers is also a lot easier, far easier than I can imagine being federal. But then comes the limitation in terms of attracting private enterprises to come in and set up shop here in Selangor. Do you see that as a key challenge to overcome and navigate, or that's just business as usual as well? Businesses would come if there is a market for it. How do you see that chicken and egg argument when it comes to attracting private money coming in and setting up more care centers in the state?
Actually, private institution or businesses has gone far further than the intervention from the government, state government.
Wow.
For example, I could name like Sunway Sanctuary from Sunway, Acacia Pacific Living in Klang, Bandar Raja Kelang, and they actually come across with some obstacles. For example, they requested on the fire department policy or guidelines that actually hinder the building to be higher. And second one, on the 8% SST. I mean, they are doing service, although it's profit making, but it's not lucrative for them to, come up, back up that 8% SST. So I think all these potentials, the private institutions, will, happy or not, they will take this opportunity to build or provide these services, whether it's targeting the T20, the upper tier of M40, middle tier. But then it is how Selangor as a state government to encourage or build that ecosystem that will promote that collaboration between state and also private institution.
So going back to the Care Summit, because a lot more of what we discussed today can be unpacked at that particular summit that is of course currently happening on the 9th to 11th of October at the Kuala Lumpur Invention Centre. And there's going to be care forums, there's going to be care exhibition, there's going to be business matching as well as town halls. Since it's co-organised by Invest Selangor, Wanita Berdaya Selangor, MBI, and of course the state government itself, how many people are you expecting? What kind of key highlights that you want people to look out for? Is it you have to pay for entry? And most importantly, your own personal mission, what would be some of the agenda that you personally would be looking at?
Okay. We co-organize with Invest Selangor. So Invest become our advisor on how do we go about this Care Summit. So this is the first, I would say, inaugural in Malaysia and particularly in Selangor, where we would like to gather and showcase the innovative products or services by our local people, and it's a platform to exchange ideas, so that any businesses could actually pitch their idea or looking for investors. And through Care Town Hall and Care Forum, these are the two platforms where we like to spark the discussion and the discourses about pertaining to issues related to caregiving and also the beneficiaries.
I bet you the right person to want to attend would definitely be my sister. She's a rehab specialist working out of Selayang Hospital, and she's into not just rehab but of course care economy as well. I think she'll be very much interested to attend to these conferences.
And it is free.
Yeah.
Throughout 3 days, and through we have care exhibition. Alhamdulillah, all 60 booths are occupied at the moment. And this Care Forum, we have 3 international speakers from Japan, from Indonesia, and also from Australia. We also have regional speakers and local speakers. And throughout 3 days, we have kiddo care, where they have this section for child minding activities or section. This is how we actually execute, walk the talk. We just don't want to show that we want to take care of the beneficiaries, but then throughout this program we can show to people that they can actually come and attend the conference, and yet the young ones can be taken care of. And we have one unique session, which is care business matching. When you go through, any interested parties go to the Selangor Care Summit website, they can actually inquire or they can actually offer what are the offerings between the two parties.
Thank you very much. This has been a very interesting conversation. I have been looking at the care economy element for quite some time now, along with my sister, but she's coming in from the actual care and longevity of the patients and the growing ever market that she's going to be facing over the years to come. But for me, I'm looking at the business side, and make no doubt there is a lot of economic activities that can be buzzing around the care economy space. Again, if you want to learn more, just head on to the social media sites of the Selangor State Government as well as SIBS, the Selangor International Business Summit, along with the Selangor International Care Summit that's going to happen in a few weeks' time. But for now, we bid our thanks to Yang Berhormat Anfaal Saari, the State Exco of Selangor, and the State Representative of Taman Templer. And for now, we go back to our regular programming. Thank you very much for watching. Catch you in the next one.